Hey everyone, welcome to week 7. I am so shocked that we are here, but I'm sure everyone is super excited that this will be the last video that they're watching for 506. So congratulations to everyone for making it to this point, because this is a really exciting, it's really exciting to close this chapter and kind of move on to your internships and kind of grow as a clinician. So this is a really exciting time. So I am really excited to, move forward and talk about our last chapter this week, which will be addiction. So working with clients who have addiction issues, most people can't connect addiction and trauma, and they just assume that addicts want to stay in their current cycle. But with addiction comes trauma, immense trauma. So trauma is the number one thing to look at with substance abuse. Whether the trauma happens once or multiple times as a child or an adult, understanding the need for numbing is extremely important, because most addicts will tell you that they love the feeling of being numb, but only some could truly tell you what they love being numb from. And that's really big, because most addicts want to numb themselves, but they can't tell you why, and they can't tell you what specific point in life made them. If you have a really intellectual addict, as I like to call them, they will be honest with you and say, when I was 7 years old, I saw blah, 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 and I met this kid and this is what we did. Unfortunately, some of these people you are going to meet have started using heroin at a very young age, or you're going to talk to that person who had that surgery and they got hooked right after that because their pain just never subsided. Addiction comes in many forms. It's not always, that person who went through the foster care system and was abused that, got addicted to heroin and never made it out. It easily could be, your mom who had back surgery. She was put on, Percocet or oxycodone because of the pain, and unfortunately she got hooked. So, addiction takes many forms. So the important thing to remember when working with addiction is that it's a lifelong battle. Just because you may have a client who comes to you and they say, they've been sober for 20 years, it doesn't mean that they still aren't struggling every day with the feeling that they tried to numb from 20 years ago. So it's really, really important to remember that. So, you may have some clients that actually come high in a session, and you may have some people who are embarrassed to share that they were clean for 20 years and that they relapsed, or that patient who's been extremely excited that they've been sober for one day. Unfortunately, addicts are in a state of thinking about one thing sometimes. They're thinking about their next urge, their next fix. So, sometimes families have been fed up, and because there's a lot of stealing, there's a lot of lying, there's a lot of putting them in danger. So you're going to see a lot of addiction and how it's kind of turned the family unit into something that isn't reliable, because somebody's child, you might find and think, well, why could anybody do that to their child? Just throw them out on the street like that. But when you talk to mom, it's been something that's going on since, they were 15. So it's really difficult sometimes for people to move past all of the bad things that have happened. So right now, society is very, very focused on the 18 to 25 range, because that's where a lot of the substances are being used, especially in colleges. A lot of controlled substances are being used, such as Adderall, Xanax, Klonopin, things like that. That's very, very big. And, then you see as young as 12 years old, where marijuana starts, and the fixation may go further from there. So one thing that's extremely interesting is that there are a lot of resources out there for adult addiction. Unfortunately, for adolescent addiction, it's still pretty new, for the fact that, you're going to see a lot of adult addicts who are on something called MAT, which is medication-assisted treatment. So that's like methadone, your Suboxone. You'll even see some people with the Vivitrol shot. But that medication is a bit strong to give to a 14-year-old addict on heroin. So there is still a lot of research, a lot of unknowns yet that are developing in that area. I think the biggest thing that we battle as social workers in our career is insurance. And You guys will learn pretty quickly that insurance is going to tell you that your client, after 7 sessions is perfectly fine. They don't need any more treatment. It's obviously our job to advocate, but when you have addiction, it's extremely difficult because, especially if you're dealing with a Medicaid population, unfortunately, the Medicaid population, they're only going to pay for 7 to 10 days for addiction treatment in an inpatient rehab. Private insurances sometimes cover up to 30 days. But unfortunately, I hate to say it, the best rehabs for addiction are thousands of dollars. And somebody who's on Medicaid is not going to be able to afford that. So they're going to go to their 5-day length of stay in inpatient rehab because that's what their insurance is going to pay for. And then they're going to come to you. And they're still going to be in a very, very high state of, what do I do now? They're going to be 5 days clean and they're going to have a lot of urges and they're not really going to know what to do with themselves. And this is unfortunately where we see a lot of relapse because the treatment for addiction sometimes is not doable for the middle to lower class. And that's where the opiate epidemic continues to grow. And we see more people coming in for attempts for help more than ever. Because of the fact that it's just growing, especially with fentanyl now, coming on the market. A lot of the heroin is getting laced with fentanyl. And for the first time, people are trying it and they're dying. They're dying because it's such a shock to their body that the first time they've ever tried it, they're no longer with us. So unfortunately, treatment for addiction it's out there, but unfortunately, the way that the insurance works, it doesn't always benefit them. So the best way that we can benefit them is pointing them toward, their support groups, their NA, their AA, working with you, working with a sponsor. A lot of Medicaids also have a caseworker, like a case manager through the insurance company. So I always say that it's best to maybe do a referral through there too, so that you're able to really get that support for that patient because they're really, really going to need it. So in conducting a therapeutic session with an addict, there's a lot of therapeutic approaches and there's a lot of literature out there that's going to tell you one is better than the other. And I always say, to be honest with you, each addict is extremely different. Most addicts are actually really manipulative. So, they're going to sit there and tell you that they have no more urges, that everything's fine, their family loves them again, everything's great. And then the next day you may find out that they've overdosed. Unfortunately, that's just a very much of a pattern of an addict. But I always find that narrative therapy is really common. Narrative therapy really allows the person to determine their own understanding of the world and their own understanding of their position in it. So it's the stories that we learn and tell that create the psychological and social realities. And on page 286 in Walsh, it gives great examples of how narrative therapy can shape the client's thinking. So, go ahead and take a look because I think that section is really helpful. Another therapy that's really commonly used is cognitive behavioral therapy, which a lot of you know. Motivational enhancement therapy. They're used one-on-one in residential detox treatment. They also have shown great progress with addiction. Our skills are used very much focused on client social worker relationship and motivational interviewing, and assisting the client and seeing their own strengths, seeing that their goals are not as far away as they believe that they are, and helping them really track down that traumatic event that caused that. Cognitive behavioral therapy is really going to pull into your cognitive distortions about what you think about yourself and what you think about the world. So changing them and changing that view is going to change the way that they view on numbing that feeling. So that really works with addiction. So working with clients who have addiction can be extremely rewarding yet tiring because unfortunately your client will be sober for a month, then they won't be. Then they'll be sober for 3 months, then they won't be. So, really make sure that you're taking care of yourself if you work with the addiction population, because it can be extremely tiring when you're emotionally invested and you're pouring yourself into these clients and these clients are relapsing. They're not using the skills that, you've worked with them to gain, and they're continuing to fall back into old habits. So really make sure that you're getting the supervision that you need. You're talking with your supervisor about some clients, and there may be that time where it may be beneficial for you to move on from a client, because if you can't be beneficial to that client, then it's no longer a beneficial relationship. So you really need to pay attention to that. So addiction is something that affects every family. It's always really important to understand the family unit in addiction as well, because you may be working with a family, or you may have a client who's affected by addiction in a different way. You may be working with a male or a female whose child is a addict, or whose parents were addicts. And working with that and helping them really understand that at some point they're going to have to take their emotional investment in their family and figure out what it is that is best for them. Because as I stated before, us as therapists will pour our emotional self into the addict, and so will their family. Their family will do it actually 10 times more, because it is their family. Nobody wants to give up on their daughter, their son, their mom, their dad. But at some point, your patient will break down. Just as I stated, you will break down. So you need to really, really guide your client and guide yourself in a way of self-preservation, using that strengths-based therapy, pulling the strengths out of them and helping them understand that even though their son is not doing well, they are doing well. Bring the strengths of, he may have relapsed, but he was sober for 3 years prior, so he can be there. So addiction, as I said, is very, very hard, and it's a very, very large topic in today's world with everything going on. So I encourage you, if you have your own children, educate them, because unfortunately, drugs are getting into the schools younger and younger and younger. The other day I work in a hospital setting, and, we had a 4th grader come in who by accidentally stuck himself with a needle that he found in the bathroom. So it is something that is out there, and it's something that as, professionals we need to be aware about. So I just want to take the time to say I really enjoyed teaching you guys. This has really been a beneficial class for me. I hope it has been for you. I really enjoyed every moment of it. You guys are really amazing, and I know you guys are going to do great things out there, because we're all passionate about social work. That's why we got here. We got here to help patients who are less advantaged in the system, so we can help them succeed. That's the most important thing. So good luck to everybody. I wish you the best. If I see you out there, good luck, guys. I know that you can do this. All right. Have a great time.